Welcome to Derbyshire farmers. Bacterial meningitis is a serious and life-threatening condition that can affect young lambs, particularly in their early weeks of life. Today we'll explore everything you need to know about this condition, including its causes, symptoms and treatment, as well as how you can protect your flock. Meningitis in lambs occurs when bacteria invade the brain, causing inflammation of the protective membranes called the meninges. This condition often arises as a secondary infection, making it a complex and challenging issue to manage. Bacterial meningitis is usually the result of another infection. Common entry points for bacteria include the navel, untreated wounds, or abrasions. Once inside the bloodstream, the bacteria can travel to the brain, leading to meningitis. Lambs with weak immune systems or inadequate colostrum intake are especially vulnerable. The most common bacteria involved are Escherichia coli, Streptococcus species, Pasteurella species, and Mannheimia hemolytica. These bacteria are often present in the environment, bedding, or even on the ewe herself. Bacteria can enter a lamb's body through the navel shortly after birth, through contaminated bedding, feed or water, or even through minor injuries. Poor hygiene during lambing increases the risk of bacterial exposure. This condition most commonly affects neonatal lambs between 1 and 4 weeks old, with the highest risk in the first 2 weeks of life. Recognizing the symptoms early can make a significant difference. Watch for signs like lethargy, stiffness, loss of coordination, or difficulty standing. Other symptoms include convulsions, fever, a lack of appetite, and unusual vocalizations. Without treatment, the condition progresses rapidly, leading to coma and death. Without treatment, the survival rate is almost zero. However, with early and aggressive veterinary intervention, survival rates can improve to 50 to 70%. It's important to note that some lambs may experience lasting neurological damage even if they recover. Treatment includes antibiotics like penicillin or oxytetracycline prescribed by a veterinarian. Supportive care, such as intravenous fluids and anti-inflammatory drugs, is equally vital to manage dehydration and reduce brain swelling. Treatment must begin as early as possible for the best chance of recovery. The cost of treatment varies depending on the severity of the case. Veterinary fees and medication can range from £30 to £100 or more, especially if intensive care is required. Prevention is always better than cure. Ensure a clean lambing environment and disinfect navels with iodine or chlorhexidine shortly after birth. Provide high-quality colostrum within the first 6 hours of life to boost immunity. Vaccinating ewes and practicing good hygiene can also significantly reduce the risk. Bacterial meningitis is a devastating condition, but with vigilance, early intervention, and good management practices, you can protect your lambs. Thank you for watching Derbyshire Farmers. Don't forget to subscribe for more farming tips and insights.